This
So right
conference will now be recorded.
again, this is Jeffrey Popkin. I'm an independent consultant working for Bakersfield ARC on the Home and Community-Based Waiver Project, a grant that was funded by the California Department of Developmental Services through the Kern Regional Center. There will be a series of webinars and community of practice every on the second and third Wednesday at 10 a.m. every month. There will be a community of practice. The first one will be for day and vocational. The second one will be for residential. And then on the fourth Wednesday of the month, there will be a webinar, which is what we have today. In addition to that, there will be a series of presentations and available to you through an organization called CQL. They're a national organization. They're involved with providing accreditation and education for providers of services to persons with intellectual and developmental disabilities. They're going to be running a whole series of courses. Two types of courses. One is going to be a 4 hour a week, 4 hour course, and they'll be offering them once or twice a month on different topics. These courses, if you were to go to their website and sign up for them, are $100 a course. Through this grant, you can take these courses for free. So I would really encourage you. They're very educational courses. We will be providing you with continuing education for the 4 hours if you do take those courses, and there will be very beneficial to your abilities to provide services consistent with the new look of how services need to be provided according to the federal and state government. In addition to that, CQL has a program where they have a 5-day workshop. So if you want to be basically, tool is called the POM, P-O-M, and if you want to be proficient in that particular tool, you can take the 5-day workshop. We are only going to be offering the 5-day workshop one time during the year, and that will only be for 12 individuals, because that's quite a commitment. You gotta be able to come up with 1 week of your time to be able to do that. And I believe it's scheduled now for what, February or March? When is it, Valerie? You need to turn on your mic.
I was just looking for that. I believe it's February though.
Okay, so we'll send out more information, but there will be a 5-day course that will be available to you if you're so interested in, and it's first come, first serve. We're going to take the first 12 people who are interested in that. The 4-hour courses, which will be offered once or twice every month, will be available for up to 40 people. And they will be webinars. So they'll be online. You can do them from your office or from your home. And they're going to be excellent, primarily teaching, but there will be some discussion and there will be some interaction in those presentations. The first one is coming up on December 5th. So that's a Tuesday coming up after Thanksgiving. And it is going to be on person-centered approaches. So it will be specific to the whole, the backbone of home and community-based waiver services are predicated on that the service is based on the needs of that individual. We used to sometimes joke around and say that we were, making individual plans that were cookie cutter. And if you know the analogy, if you were spread out a layer of dough, and then you take your cookie cutter and you go boom, 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 and you make 10 of the same cookie. There was some feelings that sometimes the plans that were being made for clients were something similar to that, where the coordinator or the day program or the residential facility would go boom, 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 and make the same plan for everybody in that particular setting. We don't want that. We want everybody's plan to be individualized. And this training that's coming up on the next month will do that. Currently, there are a number of slots available still for that particular workshop. So I would encourage you to look to attend the training on the 5th. It's going to be from 9 to 1 on December 5th. So
And just
go
letting
for it.
everybody know as well, I have emails and contact that I've received from KRC. So you'll be hearing from me via email, kind of reminding you, just a friendly reminder, because we're hoping to fill all those slots. You know, it's very beneficial for the people that we serve and the things that we do.
Yeah, we've set it up so that we have 40 slots available. So we pay the same price. The grant pays the same price if there's 20 people or 40 people there. So we want to get as many people in there to make it as valuable to you. If you have staff people you want to send, that's cool too. Just go ahead and sign up. It's first come, first serve. First 40 people get the class. Many of the classes will be offered more than once during the year. So person-centered planning will be offered again, but don't, assume that you're going to take it later and then something else comes up. If you can take it now, I really suggest that you do that. Now, just a couple of mechanics and then we'll get started. We are offering continuing education credit. I had some problems this morning switching slides back and forth as I was testing it. So I'll just verbally tell you. You have to be on this webinar for the full session in order to get credit. We're going to go to 11:30 today, which means that you can get 1.5 hours of continuing education credit, which was good for both community care licensing and for Kern Regional Center. But in order to do that, you have to be on the call the whole time. Also, if any of you have more than one person who are listening in on this webinar and you would like them all to get credit, we need to know who is on, because what's happened in the past is we've gotten some folks saying, well, can I get my CEU credit? And we had no idea that you were on this call. So if your name is showing up on the screen, then you are Valerie's has taken down your information. We also have it through the GoToMeeting format, and so we know you're on there. But if there's other folks that are on this either by phone and they didn't put their name in, or if you have more than one person at your agency or home that you've got taking this, please let us know who those people are. In addition to that, one of the things that we do is because most of you don't turn on your cameras, which is okay. We don't know that you're actually sitting here listening to the presentation for the whole hour and a half. So one of the things that we want is we want you to send us, send Bakersfield ARC 3 things that you've learned from today. So it doesn't have to be a novel. It could be just short bullet points, but 3 things that you have learned so that we know that you were paying attention and that this was a valuable experience for you. So again, you have to stay on the whole time. You have to make sure that we know who you are, and you have to submit the 3 items that you learned, 3 concepts or ideas or what have you. Okay, so with that being said, today my intention is not to reinvent the wheel. There is a lot of good material out there on the internet that is available to you for updating the way you do your services. Okay. About 6 years ago, I got a grant for Bakersfield ARC to work with the Institute for Community Inclusion, which is a part of the University of Massachusetts. And we were one of 10 ARCs. ARC is a national organization, and we were one of the chapters that was chosen to participate in this. And what it was this was 6 years ago. So HCBS was just starting to really come into play, where people were looking at trying to move from site-based, segregated, limited involvement of the client in decision making to the new look. And because we were Bakersfield ARC was a workshop where we had a large number of clients who actually came to our program every day and would work on a project and get paid at less than minimum wage. We were eligible to be part of this project. And so, anyways, I'd like to share with you a little bit about the Institute, and they have a checklist which you can use. So if you look at the top of that screen up there, it's, and I'm going to put my glasses on for a moment here. It says www.communityinclusion.org. That is their main website. Good website to go. A lot of material on there. So we're going to scroll down. Maybe if I get this thing to work. Okay, they have 4 areas that they really emphasize. One of them is employment. Building a rewarding career in community should be expectation for all citizens. With support and planning, people with significant disabilities can thrive in the workplace. And so if you want to learn more about employment areas, this is one resource that is available to you. Okay, now if you remember, the first rule of home and community-based waiver is related to if a client wants employment, that should be an option that's available to them. Now, one of the things that's happening right now at the federal level is that the Department of Justice is looking at the Americans with Disabilities Act and saying, wait a minute, programs that are segregated, meaning when the client comes to the program and they're there all day, or they live in a home and that's all they do. They don't go out into the community or anything else other than maybe going to that segregated program during the day. That is not consistent with the Americans with Disabilities Act. And therefore, we are looking at whether we can continue to fund these type of settings. And what they're saying is that clients have a choice. They can choose to go here, but we're not going to fund if they want to go there. So there may be some changes in the near future, both in terms of home and community-based waiver requirements being monitored and making sure that people are adhering to the new sets of rules. But there also is another area, which is the Americans with Disabilities Act and the Justice Department looking at seeing if our clients aren't being given their full legal rights under those provisions. Another area that the community inclusion folks over at University of Massachusetts are involved with, from pre-K through university schools, are engaging and involving students with a range of disabilities by building skills. Early young people can exit high school prepared to pursue higher education and find jobs that match your interests. And that is one of the other areas that HCBS is really talking about, is that historically when someone leaves public education, and that normally is anywhere from 18 to 22 years of age. The Individuals with Disabilities Education Act, which is a federal law, and then there's a California law that goes along with it, that having to do with um, education of persons with disabilities, and there are 5 categories in which you can get to be considered disabled for the education system, just like the regional center system and developmental disability system has eligibility criteria. Schools have eligibility criteria for who gets into special education, and most of regional centers clients, if they're younger, get into special education. Historically, what's happened is when people finish that education process, 18 through 22, at some point in that age range, depending on the needs of that individual, they go into a regional center program. So they go into an adult day service, or they go into a vocational training service. Nowadays, there are some other options. There's uh, paid internships. There's a tailored day. We're trying to expand the range of services that someone can participate in um, throughout adulthood. So, and then also there is self-determination. So some people decide that they want to be or have a facilitator, and they want to develop their own plan and not necessarily consistent with vendored services. So there are options that are available to them. So if you're interested in some of what are the education options, either K through 12 or secondary education, here locally in Kern County, Taft College has a 2-year program for individuals to live on campus and in the community, where they learn to be independent in terms of both vocational and living situation. So education's another area that the home and community-based waiver focuses on. I'm going to drop down to healthcare. Healthcare is a major concern for our clients, that we want to make sure that they're getting the healthcare that they need for them. There have been a number of studies that have shown that there is a disparity, that people with disabilities don't get the same level of healthcare that possibly you and I get. And there's a number of reasons for that. One is that they're getting Medi-Cal in most cases. 49 states call it Medicaid. California calls it Medi-Cal. So those services are available to individuals, but there's in many cases a limited number of providers that are willing to take that. So sometimes the quality of care and the availability of care can be a challenge if your clients are in Medi-Cal. Also, our clients aren't necessarily good at, in some cases, of sharing what their issues are and why they are coming to the doctor, or what symptoms or concerns that they have. And so that sort of relies on you as their provider to help them with that. And we want to make sure that. And then one of the things that also occurs is sometimes the routine health screenings, so that at specific ages, there are screenings that women should be receiving, breast exams, gynecological exams, other types of exams. There are screenings that men should be receiving. Matter of fact, this month is prostate cancer awareness month, and so one of the things you can show your support for that is what they call No Shave November. So if you've noticed the facial features here, that's because I'm participating in No Shave November. But so healthcare can be an issue for our clients. So if you want to know more about that area, you can go to this website again, click on learn more about healthcare. Where I want to focus today primarily on is the community life one that is on the bottom right or bottom left, excuse me. Um, Outside of work and school, people with disabilities are involved in a wide range of activities that make up a satisfying life. Whenever it's volunteers at a music festival, getting involved with a faith community, or attending a sports event, there is much more to do. So that's where we want to focus. Now, one of the things that uh, this Institute for Community has done is they've created a checklist. It's a tool you can use it, and we're going to go over it today, and I'll show you the website. So if you want to get on that website and use this tool for your facility, I would strongly encourage you to do that. Let me see if I can. Uh, uh, okay, so here we are. Community life engagement, provider self-assessment. So this is what we're going to use today, and we're going to go through this. I don't know if we'll get through the whole thing because it's a long assessment, but just so again, this is someone else's tool, but it's readily available on the internet. But I want to make sure I give credit to those folks. It's not mine. I'm not taking on and claiming that it is. So community life engagement is a project of Think Work at the Institute of Community Inclusion at the University of Massachusetts. And again, if you the Community Inclusion University of Massachusetts, really good site to find material. Think Work is a program within that. Just came out with a new video the other day that's really kind of a good video for on post-secondary education that if anybody's interested, I can give you the information on that. ThinkWork is a resource partially offered data, personal stories, and tools related to improving employment outcomes for people with intellectual and developmental disabilities. And the funding sources, so who paid for all this stuff is the Administration on Intellectual and Developmental Disabilities, the Administration for Community Living, U.S. Department of Health and Human Services under a cooperation agreement, the National Institute of Disabilities, Independent Living, Rehab Research, U.S. Department of Health and Human Services, Field Initiative. So there's a number of federal agencies that got together and gave this funding to University of Massachusetts and the Institute for Community Integration to put together this material. So it's out there and it's available for your use. So let's go ahead and get started. Okay. So this is an assessment you can do on your program to see where you are now in terms of what you can, what you're doing well, what you're doing okay, and where you can improve so that you're more in line with the home and community-based waiver requirements. Okay, this assessment is intended to help your organization assess the current strengths of its community life engagement, and they use the term CLE. Okay, so throughout this you'll see CLE, which means community life engagement. I always am amazed by the number of abbreviations we have as a system. I sometimes call it alphabet soup, kind of like when you go to the grocery store and buy a Campbell's soup that's got all the letters in it and you try to make words with it and stuff. We have a jumbo of things. So here's a new one for you. You can see you can use CLE. So anyway, so community life engagement. Uh, Community life engagement refers to how people with intellectual and developmental disabilities access and participate in their communities outside of employment as part of a meaningful day. The community life engagement supports may be referred to as community-based non-work wraparound supports, holistic support, or community integrated services. Another number of different names. The main thing is what you're doing. Okay. The self-assessment has two parts. The first part asks you to reflect on your organization's goals and activities concerning the provision of CLE supports in general. And 2 is divided into 4 sections representing a project guidepost for community life engagement. You will be asked to rate your agreement with several statements related to each guidepost. So there's 2 parts to this. And so what I want to do first is have you think about these first 4 items in part 1 of your organization's community life engagement goals. So where do you want to go? A number of years ago, there was a very popular author by the name of Stephen Covey. He's done a lot of work on organization and time management and those sort of things. And he wrote a book called 7 Habits of Effective People. And in there, one of his habits that he talked about was you should begin with an end in mind. So you sort of know where you want to go right from the get-go. So, and an example of that is a few weeks ago, my wife and I took a vacation and we went to New Orleans. So we got on the plane, and as we got into the air, the pilot said, "Okay, we're going to be flying at 38,000 feet. We're going to be heading in a south easterly direction, and we're going to go over Texas and then come into Louisiana, and we anticipate being on the ground in 5.2 hours, and we'll be at Terminal 4." So sort of knew where he wanted to go. We knew the direction of where he was heading for. If we would have got on that plane, and if the pilot would have said, "Oh, we're in the air now, and we're going to see what the air current is, and kind of, as we go, we'll kind of figure out what's going on, and we'll get there. But I'm not quite sure when. It'll be around 6 o'clock." You would have a very different view of what was going on and have a lot less faith in what that pilot was doing. So you really want to think about where you want to go. So what specific outcomes are you hoping to achieve by using the tool? So where do you want to take your facility? Are you okay with where you are right now? Do you think you're doing a great job and you just think that, wait a minute, I got to take these classes, so I'm going to take these classes, but I really don't think I need to do anything? Then that's one thing. That's the outcome. A maintenance goal. I want to just maintain where I am. But if what you're saying is, wait a minute, I want to make sure that I'm doing things that really take into account what the clients that are participating in my program, in my residential facility, in my day service, in my work program, really want. I mean, we're going to sit down with them. We're going to talk to them. We're going to find out what they want, and we're going to want to try to do this in the community, so that we're not going to do it in a building someplace. We're going to do it where people live, where they work, where they have activities. I worked a number of years ago with an independent living skills program that taught people how to do laundry. And they had a home washer and dryer. When the clients ended up moving out on their own, one of the challenges was that the washer and dryers were very different in a laundromat than they are in your home. And the clients lost a lot of the skills because they didn't know how to use the machines. So that they didn't know what to do. So teaching the skills where people will use the skills, which is in the community, if that's what we set as a goal, is very important for moving on in this direction. So anybody want to just open up your mic for a second and share with us what specific outcome you hope to achieve by looking at a community life engagement tool? Okay, let's move on. Oops, we've gone too far. Okay, what are the strengths of your current approach to the provision of community life integration supports? So, what are you doing that you think is really a good approach to getting people out in the community? Now, let's say an example is that you contacted the ministers of the churches of three of the clients that you have in your home who said that they would like to go to Sunday services or be involved with a Bible study class, and you've made arrangements with that individual to that pastor to have somebody assist in getting the clients to and from and facilitating their involvement in that particular faith-based activity. So that would be an example of strength that you've done. You're taking your clients out to different community activities at least once or twice a week. So now that we're getting into the winter holiday season, maybe you're going to take your clients out to the light show out there one evening, and then you're going to be doing another thing. So you're looking at themed activities that you can do over the month of December, the Christmas parade that's coming up in a few weeks. So different things where they're out in the community and able to participate in the same activities that you and I might do. Okay, the third item is describe an individual's life that best reflects success for community life. So think about people who are living in your home. Think about people going to your program, who are working out in the community that you're supporting, and what would be the strengths? Excuse me. Of someone that's really doing well. Some of you have met Nicole. I don't see her on the thing today, but she's an individual who has involved with cerebral palsy, uses a electric wheelchair to get around, but living in the community, being involved, having services and supports geared to both her independence and her need for self-care and other assistance. So that would be an example of someone who's making it, and she's also working. So doing the things that she wants to do in terms of engaging with community. Um, describe an individual's life that best reflects success. Okay, all right. Uh, and then moving on. Okay, what do you see as needing improvements in your supports? So again, if you're seriously thinking about community living engagement, you need to look at both what you're doing well and what you can improve on, because we can all improve on things. So, for example, we're taking our individuals out to Valley Plaza every week, and we're walking the mall. That's community integration, right? Well, what's meaningful about that? I mean, it's exercise. They're getting if they walk the mall once or twice, that's a pretty good walk. We all need to receive exercise, so that's. But what do they? Did they go to stores? Did they talk to people in the stores? Did they interact? Did they buy? Did they make purchases? Did they talk to maybe the manager of a store about what it would take to be hired for that employer. Did they go into a store and maybe ask a clerk, where do you find a particular item? So what did they do that was reflective of community living? Did they go to the food court and order food? And after they looked at the different options and decided on what preference they would like to eat. So these are there's a difference between going someplace and then doing something meaningful at that place. So that's one of the things that you want to look at. What are your organization's primary barriers to supporting community life integration for people with development? So what seems to sometimes get in the way? Um, you know, frankly, I, I feel like sometimes the system itself, when we have to work with licensing and regional center and all these other folks, that and their Title 17 and Title 22 rules and Lanterman Act and all these other things, if your person's going to a day program or lives in a residential facility and you're working with them, sometimes there are a lot of other players in this, and sometimes we create barriers intentionally or unintentionally, which really do have an effect on the outcomes for the people we serve. And again, what existing opportunities or resources can be tapped to facilitate your efforts to improve community life engagement supports? So what's out there that you can use? You ever thought about maybe parks and recreation, the library, senior centers, maybe gyms, other resources, volunteer work that people can do. There's a lot of activities out there in the community that you can tap into if you just look at what is available. So if you go, onto websites like our three local TV stations have community calendars. The Bakersfield Californian has things that they publish. There are things that you can look at and do within the community for that are meaningful, that are involve the client, and that in many cases the individuals will enjoy. But again, it's got to be their choice in terms of the activity. Oh, we found this activity, we're all going to go. Again, that's not what we want to try to do. Found this activity, who here in our grouping would really like to do this? Okay. So now we're going to move on to the second part, which is really the nuts and bolts of this assessment tool that you can use. And again, this assessment tool is online. If you want to print it out, you want to use it online. If you want to do a thorough look at how you're doing what you're doing to try to improve, it's a good tool. It's a good tool. I mean, I know it's not for everybody, and some of you are probably saying, "Wait a minute, this is just an exercise and in information," and it's not. The value of this is actually doing it. So if you do it, you will find that it's helpful. If you just sort of blow it off and say, "Okay, that's good, that's all right," I know that there's a tool out there. When we at Bakersfield ARC started looking at the direction that we wanted to go, and we were thinking about this for quite some time, but then in 2020, when the pandemic occurred and we had to close our site services for a period of time, we decided to move forward quicker. And we went back and we looked at assessment tools like this. and did some brainstorming and really said, okay, so where do we want to go? What do we, where's it, what are we good at? What are we not so good at? And that helped us quite a bit in terms of making some of the changes that we did in that it really does get you to focus on positive uh, interactions that are consistent with what the 10 HCBS rules uh, require us to implement. Okay, so again, put on my glasses. Please think about how much each of the following statements reflects the policies and practices of your, it's a state, but we're just saying agency as a whole, indicate the degree to which you agree or disagree. If you answer strongly agree or agree to most of the assessment statements in a guidepost or subcategory, you are likely providing high quality CEEs. Other areas indicate an area that can be improved. So if you're over, when you answer these questions for yourself, and you don't have to answer them out loud, if you are more onto the agree or strongly agree, you're more likely in touch with community integration. So first one, start with an understanding of personal preferences, goals, interests, and skills. Individuals choose the activities they participate in, i.e., from a list of options or based on community exploration. So think about it for your facility uh, you're involved when you have activities. Do individuals uh, choose the activities that they participate in? Do you have a list? Like I was saying, there are sources you can go to, the community calendars, local newspaper, etc., websites that give you what's going on in Bakersfield, and so you can go to those and it's offer those to your individuals and say, okay, which ones would you like to go to? Again, if you disagree or strongly disagree versus agree or strongly agree, really shares with you how you feel about this area. Some of you may still feel that, wait a minute, the clients that we have in our home, uh, their ability to be decision makers are limited due to their intellectual capability, and you may feel more in the direction of disagree or strongly disagree. Again, that is not is sort of selling your client short. That anyone can make decisions and have everyone has preferences about what they like and don't like, and just because someone is nonverbal or has limited communication or doesn't really oftentimes share preferences doesn't mean they don't have preferences. You just have to work with them in trying to uh, get them to share or figure out non-verbally or other ways what seems to make this person happy. It can make motivated, you know, and that's going to be better for you as a provider in that your client will uh, do better within your home when people are happy. I am by background somewhat of a behaviorist, and I sort of think that all behavior has two uh, things that we want. We either want to get something or we want to get away from something. So when you look at somebody who's, people will talk about, well, so and so is having a behavior. Well, okay, well, good. I'm glad they're having a behavior because if they didn't have a behavior, they would probably not be alive. But what is that behavior and why is that behavior? And if we're really looking at giving people choices, then they're more likely to be satisfied and happy and motivated and willing to work with us towards goals. Okay, the next one is staff are encouraged to introduce their personal interests to individuals they support, i.e., if a staff member enjoys outdoor, he or she may want to take individuals hiking or kayaking. So if you have things that you like to do, share them with your residents, share them with your day program. At Bakersfield ARC, we have one gentleman who is an avid fisherman, uh, loves to go fishing. He has now got a whole group of clients that he will actually on a Saturday on his own time will go out and take, and they go fishing. And so he took an interest of his, introduced it to individuals, and some liked it, some did not. And if those individuals that did, that's now become an activity that they're involved with. So again, some people feel that, wait a minute, what I do is private. I don't necessarily share with my clients about me. And so they might strongly disagree with this or disagree.
Jeff, not
Think
to get
about
off topic, you
what's that?
have, not to get off topic, but you have someone asking where to find the survey. They're on the community integration website and they want to know exactly where to get that from.
Okay, yeah, it's if you look at the page that you're on right now, um, the screen at the top of it, because it's just showing the a web page. It says HTTPS / archive dot communityintegration.org. And so if you copy that down from the top of the page, is it showing up there, Valerie?
Oh, on your end?
No, on the your end. I mean, can you see at the top of the page where it's got the web address?
Oh, Jeff, I could see it does have the the address, the HTTPS address.
Right, right, yeah. Okay, that's the address of where you can find this. So if you want to just write that down, that's where you can find this survey. And then, like I said, if you go back to the previous page that I showed you too, you can get the whole University of Massachusetts the Community Integration Program website. And this is all, publicly available. As I was mentioning before, I don't like to reinvent wheels. If somebody has done it and they've done a good job and they've made it available, I'm going to, hopefully share that with you so that you can use it as well. Okay, individual goal preferences and interests are recorded, available, and known to all staff. So if you find out through working with this individual what they really like, and you also know what they've asked for in their individual plan, make it available to all the staff so everybody knows. So hey, wait a minute, Johnny really likes to take a walk around 6 o'clock every night through the neighborhood. Okay, so maybe there's a substitute staff person on one night. No, we don't let anybody out of the home. You can't do, yeah, and then you just frustrate the individual, and it could easily be avoided if this other staff knew what this person's preferences are, likes are, what's important in their plan. You know, I've seen it done a couple of different ways. Some facilities and day services, vocational services, make the IPP available to all the staff. Some do the individual service plan, which is the plan that you as a provider write up to how you're going to implement the IPP is made available to the staff. And I've been out to some facilities where, oh no, we keep the record locked up, there, and the DSPs don't see any of it. And so I always wonder when I go out to a facility and you don't see any of the plans for that individual, how do you know what seems to be working? How do you know what the clients ask for? So to some extent, I mean, you have a balancing act. You have confidentiality, where you want to maintain that the material that you receive on the client is properly stored. It's compliant with both the regional center DDS rules, and also there's they fall under HIPAA rules, the federal laws related to healthcare privacy. But on the other hand, these are your staff. If you've trained your staff in respecting people's privacy, and that anything that happens during the time they're working with that client is private. So all material that is done throughout the workday is indeed confidential. And so that way, then you can share the plan, share your individual service plan. If you feel comfortable, you can share the IPP. But that's one of the ways that the individual's goals, preferences, interests can be shared with all. So again, do you agree with this? Do you disagree with this? All right, Leslie, we'll post it out there for everyone. I'm assuming that if people want it, they think there's some value in what I'm sharing today. You're shaking your head yes, Leslie. All right. Okay. Emphasize person-centered planning and discovery. So person-centered planning is emphasized at intake. So for the most part, you're not really involved with intake per se, unless you're receiving a new client. So if you're receiving a new client in your facility, then there is an intake, and you want to make sure that you're in the old days, we would say to somebody who came into our programs, okay, so welcome to XYZ day program. From 8 to 8:30, we do this. From 8:30 to 10, we do that. Then 10 o'clock, you get a break. Then we do this from 11 to 1. And it's lunch and 2. And then you go home and thank you for being part of our program. And here we go. And none of that was asking the individual what they wanted to do or what was important for them. We had our daily schedule, and that was it. I was out at one program one time where someone said to me, well, at 2 o'clock, we do, as part of our day service, a lesson on personal hygiene, where we look on like a brushing hair, brushing teeth, washing our face, some other basic hygiene stuff. And Susie doesn't want to participate in that, so she's being resistive. And I said, well, let's reframe that. Maybe the issue is that's not an issue that's important to Susie. So how can you look at developing a different 2 o'clock activity for this individual? Because the one that you have everybody going through is not one that she wants to go through. So let's look at, is it about the client's desires, or is it about the facility's schedule? And we want to try to make it about what the client would like to do during this particular time. The individual's family, friends, employers, and others are actively engaged in developing and revising the person-centered plan. Again, first and foremost, the client has the choice about their plan. So if a client says to you, I don't want my parents, I don't want, other people involved in it, then that's their choice. We have to respect their choice and make sure that we are doing what they're requesting from us. So we want to make sure that our day program plans or our residential plans that we develop are include the people that the client wants to be included in that meeting. To the extent that we can have others involved, that creates more of a circle of support, that other people who will sort of keep an eye on the client, see whether it's being implemented or not, can assist in its implementation, can kind of, if it's not going well, maybe come up with some ideas of how we can do things differently. So the more people we have involved, in many cases, it really does benefit the individual. Once in a while, you'll get a family member or someone that is not beneficial to the process. And that's a whole other issue and something that you can work with your service coordinator at regional center and to figure out what's the best way to proceed when there are challenges that are arising externally from other participants in the client's planning process. Person-centered plans are updated at least yearly to make sure that they align with the individual's goals and interests. Now, there are the actual Lanterman Act, which sets up regional centers, says that the individual plan shall be done at least once every 3 years. There is some language also, though, in some of the federal stuff saying that the plan for those clients who are on Medicaid waiver has to be reviewed yearly. So it's my understanding that Kern Regional Center, for the most part, is doing everybody's plan yearly to begin with. So everybody, for the most part, gets a new individual plan on hopefully their birth month or within a month or two after, if things are backed up at the center or the scheduling is a challenge. And one of the things that you want to look at is you want to take a look at last year's plan and then help you develop this next year's plan. But historically, if I went back, let's say 8-10 years ago and looked at individual program plans, I could go look at one from, let's say, 2010, 2011, 2012, 2013, 2014, and they would basically be the same plan. That people would go out, say, okay, how's everything going? How's your health going? What's going on? And they would sort of replicate with maybe some minor changes the same document that they had used previously. And that's not what we want to do now. In some cases, the goals will be the same because they haven't really changed, but hopefully there's been some progress. There's been some change as our clients are introduced to new community activities and things to do that they're and new challenges. They say, hey, I want to do something different. I don't want to do the same thing over and over again. I now want to try. And so the plan should reflect that. So when you're doing your individual program plan, and also as a provider, as a residential or a day program provider, when you're doing your service plan, you should be looking to, okay, so what's unique about now that wasn't there last year? What's changed? Where has there been the growth? And if there's been some changes to what the individual would like, I mean, think about for yourself. I mean, every year when you sit down with your employer, if you're a staff person, or if you're a boss and you're running program evaluations for people, you don't want that plan to look identical year after year. Hopefully there's been some growth. Hopefully there's been some challenges. There's some things that can be different from last year's report to this year's report. Okay, staff receive training in person-centered planning and thinking. So, and hey, December 5th, CQL. If you are looking for a place where you can provide training for your staff, and that would be an excellent opportunity to sign up. So sign up now and reserve your spot. Again, it's first come, first serve. First 40 people that sign up get to be involved in that webinar. So if you want to provide your staff with some training on what person-centered planning is all about, because that is the backbone, the major entity of what HCBS is all about. It is that the client's plan is about what the client wants. And, as Michael Small, one of the gurus of person-centered planning, has said over and over again, what's important to and what's important for the individual. So I want to continue to focus on those. Okay, consider creative staffing, intentional grouping, and generating supplemental funding. Okay, now some of this may or may not work because I'm not sure where we're going to get supplemental funding, but we'll go over these. Anyways, flexibility in staffing resources and scheduling exists in order to accommodate changes in individuals' daily, weekly activities, i.e., if an individual work schedule changes or he or she is not feeling well, you have some flexibility for staffing. Easier said than done, especially in these days when there's such a chronic staffing shortage. And keep in mind that our friends up in Sacramento in this session that just ended did two things. One, they voted for to make it so that fast food workers will, as of I think April of next year, be making $20 an hour. And over the next couple of years, people who work in hospital settings, so people who maybe or orderlies or janitors or some of the non-medical professionals that are so integral to making sure that a hospital works, will be making $25 an hour. So now if it wasn't like bad enough to try to get staffing for your facility, it's going to be that much worse because minimum wage, I believe, is going up to $16 an hour here in California as of the 1st of January of 2024. But it's, like I say, in April 2024, it's going to 20 for people who work in fast food. So, some folks may make a choice that they would rather be, flipping burgers than having to deal with the personal needs of individuals with IDD. So when it talks about flexibility of scheduling, that is sometimes, like I said, easier said than done because scheduling can be a real challenge for providers if they're short-staffed. Many of you probably do double shifts or sometimes have to call in someone at the last minute. So to the extent that you can do this, it really does benefit the client, but there is a reality as well. If group activities are scheduled, the activities have been tailored to the individual interests within that group, i.e. individuals with an interest of photography might be grouped together to take a community educational class. So this is more towards day programs, but if you're having groupings of clients, do it in such a way that it is a group that has similar interests. There can be some challenges to that. And, earlier on, we talked about what you're doing well and what you're not doing well. One of the things that I know that we've experienced at Bakersfield ARC is, we are now totally community based. So we go out and we pick up the individuals we serve in the morning, take them to the activity for the day, and then bring them back home so that they're not brought to a site and then go out. Well, the disadvantage of that is that a lot of that transportation is done geographically. So we're picking up a group in the Southwest, in the Northeast, and so is that group now a homogeneous group of people who all want to do the same thing, or is it based off of geography? And it's something that we're having to look at to make sure that we're not doing it based off of that's how we pick people up versus what's the preferences of the individuals that are serving. So you always find challenges with this. If group activities are scheduled, individuals are grouped with friends, people they invite to join, or otherwise compatible individuals. Individuals have a say in who they spend their day with. So if you're taking a group of folks out into the community, are these people who like being with each other, who want to be with each other, who enjoy each other's company? Friendship's important, and if you read our last newsletter, the focus of that newsletter was how to go about assisting individuals in developing friendships, both with other individuals who are served by the regional centers, but also, and more importantly, individuals who are, part of their communities. And, so we don't want to place people in an activity with somebody that they just don't get along with at all, if it's possible. I know if you're a small family home and you got 3 or 4 clients and the whole group is going someplace, that may be more of a challenge. And again, how do you do an activity with people who maybe aren't friends and don't want to be friends? And that is a major challenge. And again, one that you might want to, if you go back up to the top and answer those questions up there, could be one of the challenges that you look to try to solve for your facility. Okay. Individuals receive CEU supports from different staff throughout the week or day. This is one that some people feel is really important, that if you're always receiving the same staff, it limits the who you interact with. And that by interacting with more people, it gives you more opportunity to learn skills. Again, if different people have different preferences, like the example I mentioned earlier about Kenny and taking groups fishing, that's, and one person, then maybe they'll go with Susie at another time, and Susie's big passion might be cooking, or and maybe a group of clients will go out and go to a kitchen and be able to do something in regards to that activity. So having people have different staff people throughout the week and day and time, it can enhance opportunity for folks. How are we doing on time here? We got okay, another 20 minutes. Individuals interact with people without disabilities aside from staff throughout the day and week. So do your clients have an opportunity to interact with people who aren't either staff or clients in the system? So do they go out into the community and talk with people, interact? Like I said, if you go to the mall, are they asking clerks about, where do they find something, or this is my preference. How can you help me find what I want? How do you go about getting a job here? Maybe if they're going to an activity that they want to go to, a club or a church activity? Are they talking with other parishioners and talking about maybe what's going on in their life? Maybe talking about something related to today's sermon, or so interaction with the general population. Some of you have heard me say this before, but there are individuals out there who the only non-disabled people they interact with are people who are paid to be with them. So that if and how would that make you feel if nobody in your life interacted with you because they liked you, they knew you, you shared a similar hobby, you were their neighbor, there was something that you had a common bond with, but the only people who interacted with you were people who were paid. Hey, you interact with Jeff because that's your job. And that would sort of, I don't know, it would for me say that I'm not that valuable of a person because people only like me if they're paid to like me. Yeah. Individuals participate in activities in typical community settings where people without disabilities participate. Again, utilizing that community calendar that's out there on on websites from TV and radio stations, the Bakersfield Californian, other sources where you can find things within the community that you can do, that you can take your clients to and have them potentially participate and interact with others. Individuals have their own membership in community groups, i.e. the YMCA, Art Center, community, or other activities. A number of groups have looked to things like gyms, getting gym memberships. Again, the YMCA, if you have clients who are aging, maybe they can be involved with a senior center, or maybe a community center that's out there, using parks and recreation, Bakersfield Parks and Recreation, north of the river, Greenfield, some of the other parks and recreation districts throughout the greater Bakersfield area. And if any of you are on the call from Ridgecrest or Bishop area, activities out there that are available. Existing community resources are used for activities in lieu of in-house programming, i.e. learning to sew at an adult education class rather than a class organized by the provider. So if you're going to be doing an activity, look for someplace that there's maybe a community group. Maybe there's a sewing circle in the community that gets together on Tuesdays that, where a group does that, just kind of like, book clubs or other social activities. And sometimes you can find groupings of like people who have hobbies or interests that get together with some regularity. And if a client has that interest, get that client involved with that particular group or organization. And many of these are free, so that's a good way to go too. Your agency has relationships with non-disabled specific community organizations, i.e. recreation centers. Again, there's a couple here in Greater Bakersfield, at least 3 that I know of, that have pretty good parks and recreation programs and a lot of activities. I happen to live in north of the river, the recreation area, and I've seen their book. They put out I don't know. It's been a couple of years, so maybe it's just on the internet now. A lot of people aren't doing paper anymore, but they have a regular schedule of activities that they do, that people that are available to the community. Some are free, some have a minimal charge for the program, but I would encourage you to get a hold of your Parks and Recreation District where your program is or where your home is, and see if there's activities that are available. Also human service agencies, sometimes there's activities, there's, for example, maybe they can get involved with some volunteer work. The food bank, other services. We have at Bakersfield ARC a group of clients who on 1 or 2 days a week go out and help maintain the grounds at COM. So we volunteer to, at the zoo to assist with their staff on, maintenance and keeping the grounds pristine. So we want to increase access to inclusive opportunities. Staff receive training in resource mapping or other strategies to identify resources in the community. Again, the CQL trainings that we're going to be providing, there is specific trainings that will be coming up on use of the community. And that will be a 4-hour training that will be available to you and your staff. All of them our first 40 participants get to participate. So if you are interested in that, keep your eye out. We are sending out regular blasts, announcing classes when they come available. If any of you are not on our newsletter, you can contact Irene at Bakersfield ARC, and she will put your email address on there and you'll receive them. We publish a newsletter once a month, and then we also send out blasts in addition to that. In addition, Leslie from Kern Regional Center, who's the HCBS coordinator, has been sending out reminders as well about some of the courses that are out there. So keep your eye out, because the training and resource mapping use of the community is going to be out there in the next few months, and I encourage you to participate in that. Just looking at time. Okay. Ensure staff presence does not limit connections with other community members. Staff are encouraged to use their own social networks to create opportunities in communities for individuals. So maybe you have groups that you're involved with. Can you get a client involved with that? A number of years ago, I was involved with the Bakersfield Exchange Club, which is a service organization. And I was on the executive board. At the one point, I was the president of that organization. And I said to my fellow chapter members, what about having someone from Bakersfield ARC become a member and participate in the activities that we do as a service club? And the group said, okay. So this individual happened to have lived at home and had older parents who were still driving, and they were able to take him to and from the activities, or if not, one of the other members would come and pick him up and take him to the activities. And he was an integral part of our service organization for many years. So that's one of the other things. So that was a resource that I was involved with, that I got a individual into. So think about that for yourself. If you're involved with clubs or organizations here in the community, and you have somebody that you're working with that you think might be interested in that particular activity, go for it. Community volunteer opportunities are encouraged and sought out. And again, there's always community volunteer activities out there. Hospitals, churches, social service agencies, some nonprofits, like I mentioned earlier, the food bank, shelters. There's other activities, SPCA, think about it there. And again, you can go online, find some of them too. And that's a good resource to look at, to look for other activities. And then I'm going to stop with just this last one here, and then 3 and 4 we can go ahead and work on in another session. I've got community set up for both the community of practice and for the webinar for next month as well. So we can continue on with some of this stuff next month. So this will be the last one that we'll do today. Community participation supports are tailored to each individual's preference level and social interaction. If someone doesn't want to be social in his or her CLE time, he or she is not required to do so. So you may have some individuals in your program who sit there and say, I don't want to go out to the community. I don't want to do this activity. This doesn't appeal to me. I want to just stay here, be by myself, maybe play video games, do some other stuff. People should have the right to do that as well. So we want to make sure that, we're not, again, one size does not fit all. So when we're looking at trying to develop these resources, maybe there's somebody who would prefer to be a little bit less involved rather than more involved. And we want to be respectful of that as well. Keeping in mind that some people maybe are shy, or they're unsure, or they're afraid, and providing them with an opportunity to learn some new skill. Once they learn it, they may become very excited and feel very good about it. But it's, again, an individual preference, and we want to be able to, the more we understand the people we work with, the better able we are to really look and focus on trying to figure out what works for them. Okay, like I said, there's guideposts 3 and 4, and there's some other materials that we can cover, but we'll do that in subsequent sessions. Are there any questions, concerns, statements anybody would like to make? Just open up your mic and go ahead.
I did want to add an update, not related to the form that we just reviewed today, but just to let providers know that we are receiving guidance from DDS on our ongoing monitoring practices. And one of the areas that I do want to highlight is the stress on attending trainings like this one, as well as person-centered planning, to reflect how your agencies are continuing to ensure that you guys are including these new practices in your care. So I just wanted to add that part.
Yeah, so you guys are the good guys. You guys are doing it right. You're taking the training, you're making it sure. For those that are not here today, this webinar will be posted on the Bakersfield ARC website. If you go up to the upper left-hand corner of the website, there's an area that says boot camp. That was the original training that we did last year, and we've just kept that title, and we continue to put all the trainings on that site. The one disadvantage of taking it through the boot camp is, well, it's two. One, it's not live, and so if you do have questions or concerns, you can't raise them. And two, there's no way of us knowing that you've taken that through the website. We don't have a tracking on that. So we will be doing. There's no way we can give you CEU credits for that if you take it that way. Leslie, on the VAC, Jeremiah will be attending the meeting, and he'll bring it up there. I don't know. I've got to talk with him. I haven't had a chance to, whether he's going to be doing a presentation similar to what I did last year or not. I don't think he's going to be doing the full presentation, but he will be updating people and letting them know about the trainings at the VAC meeting.
Thank you.
Okay. Any other questions or concerns anybody has? Well, thank you for your time. For those of you who celebrate Thanksgiving, I hope you have a happy Thanksgiving. For those of you who do not, hey, you have 4 days off in many cases, or at least tomorrow off. So enjoy, and we'll see you again. Like I said, the next training will be on December 5th. Will be the CQL, and then the following week, I believe that's the 13th, but I don't have my calendar right in front of me. That Wednesday will be a community of practice. So look forward to seeing you then. Newsletter should be out probably the second week of December. All right. Bye now.
Thank you. Jeff,
Yeah.
this is Jane. Can you hear for a second?
What's that? You broke up, Jamie.
Pardon? Can you stay on for a second?
I can stay on. Yeah.
I'll call you.
Okay, call me, please.
Okay.